Okay, so the things,
Your lungs are okay.
the things that you're looking for are rales and rhonchi and wheezing. And so if I were writing your note, I would say that your lungs are clear to auscultation bilaterally. That means I didn't hear any wheezing, rales, or rhonchi. It's just, if you got stuff in your lungs, you hear different types of sounds. I won't go into what sounds like what, but yours didn't sound like anything horrible.
Okay.
So you did good. All right, and so I'm not gonna do the anterior. In their pulmonary valve, you put it here. You wanna listen to their tricuspid, you put it here, and then mitral valve, you put it here. That is not at all where they're located because your heart is here, so that's just the best places to hear those valves respectively. All right. Appendix, you place your hand on the patient's right knee and ask them, raise your leg, raise it. Are you in excruciating pain?
No.
Well, then you don't have appendicitis. And there's other ways to do it this way now. Now, Murphy's sign is you hook your thumb and fingers of your right hand under the costal margin. So costal means ribs. I'm not going to do that to you. But basically, I go like this, and you take a deep breath, and then if that hurts, that it's an inflamed gallbladder. I bet your gallbladder is not inflamed. All right, so you can sit up now. We'll do MSK, which is musculoskeletal. That's what I'm gonna go for in about an hour. All right, so you go through each thing. You hold out your hands. Let me inspect, because you look first, flip them over. All right, good so far. And then you would actually palpate each joint. So I'm assuming they feel fine. And then make a fist and spread your fingers. Other hand, yeah, you're doing pretty good. And that's called ROM, that's range of motion. So that's especially important when you're doing musculoskeletal exams. Range of motion is something that you're definitely going to look into. And then you look at the wrists. Let me see. Both sides. Yeah, okay. Now, can you guess which side of your hand is the dorsum?
What would be the other side called? What was the other side called?
Well, the anterior would be the other side. Yeah, there's a lot of words for the same thing.
Okay.
So instead of saying posterior, you can say dorsum.
Oh, okay.
So first you think about a dolphin's fin.
Yeah, that's
Yeah,
what I was
that's it. So remember how I showed you the anatomical position earlier of like this?
Yeah.
So if you're like that, where's your dorsum? Yeah, so which is your dorsal side of your hand?
The back.
Like yes! Okay. All right, so palpate. You flex and extend your wrist like this. Other side. Both sides. And then in and out like this. Yes. And then I'm going to inspect your elbow. Let me see that elbow. All right, what was the opposite side of your elbow called? My 3-year-old knows this. Anti-cubital fossa. I said it about 30 minutes ago. Y'all should have been taking notes. All right, anti-cubital fossa. Let's see. Come on, flip them over. All right, let's see. All right, looking good. Okay, and then palpate the bones of the elbow. So, you know where your ulnar nerve is? Right here. You feel that? I wouldn't really do that too. Yeah, take a
Is
look.
that the funny bone?
It is. It's not a bone at all. It's the ulnar nerve. It is not a bone.
Okay.
The funny bone, not a bone. Ulnar nerve. Okay. And so there's a lot of really good ones here. So empty can test. This is really good. So you're going to put your arms out like this. Okay. And then hold some cans. Hold those cans. And then empty them. Yes, that's the empty can test, right? And then try to lift your arms up. All right. Empty can test. So the empty can test, originally described by Job and Moniz to test the integrity of the supraspinatus tendon. I think your supraspinatus tendon is probably pretty good.
Okay.
So, all right, let's see. Another thing, a acromioclavicular joint, that is the one that's right here. Then you have your acromion process. Let's see. You have an acromion process, that's good. And you go like this, go like this. And then like this, and the same. That's the painful arc sign. Do you have pain in your painful arc?
Nope.
Good. And, okay, so, does anybody know what epicondylitis is? Tendis elbow. And so you would like feel around in their elbow. Obviously, if they're like, ouch, they may have some tennis elbow. And then Phelan sign for carpal tunnel syndrome. Who knows what carpal tunnel syndrome is?
It's when you're like dizzy, you like get up and.
No, but I like that you answered the question. Yeah, if you overuse your fingers too much, usually typing, that's carpal tunnel. So let's see if she has carpal tunnel. All right, you're gonna go like this. Do you feel any numbness or pain?
No.
Well, then you don't have carpal tunnel. Does anybody here have carpal tunnel? Carpal tunnel. So the reason this tests this is this tests the medial nerve because it puts pressure on the medial nerve in your arm, which is something that if you had carpal tunnel would be very painful and difficult to do. But it looks like nobody has carpal tunnel. Do you hear it?
Yeah.
Do you hear it on both sides equally?
Yeah.
Okay. Sometimes people hear it louder on one side or the other. That's not what you're going for. You want them to hear it on both sides equally, so you pass the test. Now, that's the Weber. The next is the Renee. Oh, this is a good one. It's like this area here. So, we had to find this on each other in medical school. This like part that sticks out right here. It's where your femur enters into your pelvis. Greater trochanter. All right. So
Right here.
for 3 seconds, harder. Okay, let go. Do you see any kind of depression?
No.
No, but when I was pregnant, you would have gotten stuck in my leg. That would have been pitting edema. So when you're writing your report, you would say like, if it's okay, you'd say like +1. If it's like real crazy, like mine was, +3. So you check for edema. And what could that mean? What's going on with edema? Yeah.
Retention of bodily fluids.
Yes, exactly. So it would be the, like that person earlier where you look at their jugular venous pulse and they're like laying at that 45-degree angle and you can see it because they're fluid overloaded. Fluid also is pulled by gravity and it would be sticking around in your legs. And so that could be an indication of heart failure, among other things.
Is there like a reason why it's common in pregnant women?
So, if I had to guess, and so the first thing is that like anytime you ask about anything about pregnant women, oh, we don't know, we don't do research. I think if I had to guess, I think it's because the baby presses against the inferior vena cava, which inhibits the ability to bring the fluid like back up into circulation. Also because there's fluid shifts and it's basically like your physiology becomes like an alien's when you become pregnant. Let's see. Yeah, good. No school year.
Did I hit harder?
I think so. Did it work here?
Yeah, a little.
Oh, it's working.
Here? Yeah. Maybe? Yeah, we go
Just like go around my
All right, if anybody wants to try my knee, if you can't find a knee, mine's a very good one.
So do I hold it?
No, go back down.
Yeah. Over here. Go down the tiniest bit. Okay.
Oh.
There's fast.
That's so good!
That was fast.
Wow. I did that was involuntary. Oh, nope.
Oh, there.
But
It's like,
you missed the first time.
yeah.
Ah!
Okay, yeah, so it's like below, like well below. This is funny because when I was doing it, it was moving maybe like 1 inch.
Yeah. Let's see. Can you get my Braco
Okay,
radialis?
so where would that be?
You press right here, and then you hit on your own fingers. But what it does is make your hand move.
Okay.
No. No.
Also, okay.
Press harder. No. No. You hit here.
Oh, like your nails.
Yeah, that was it.
Okay. That like hurts my fingers.
Yeah, well, it worked. All right.
Oh, that was. Can you hear it equal on both sides?
Mm-hmm.
Great.
No, I still.
Can you hear it?
Mm-hmm.
Can you hear that? And now. Great. Perfect. Lower.